Believe it or not, most doctors and hospitals accept Medicare, or at least they accept original Medicare. But to those who are not completely familiar with the ins and outs of Medicare, you may actually have some pleasant surprises as to who will accept your Medicare coverage, but possibly also some disappointing surprises as to who doesn't. Hi there, as always, if you have any questions whatsoever, you can give us a call at the number on the screen or reach us in the comments below, and we are more than happy to help answer any and all of your questions. But before we get too far into today's video, make sure to subscribe to stay up to date because yes, we do release these videos on a weekly basis, and please make sure to give us a like. Click that thumbs up so we can get this information out there. All right, so today we're going to be talking about which doctors accept Medicare. So first, let's start with the basics. Most general practitioners accept Medicare, that is to say, original Medicare. Now, there are some differing facts and figures out there, but the most popular study estimates that somewhere around 93% of doctors accept original Medicare. Now, that is not to be confused with Medicare Advantage. So Medicare Advantage actually replaces original Medicare entirely, and it's offered by private insurance carriers. So you can either get an HMO or sometimes a PPO, which means that you may need to operate in-network, so you'll need to check to make sure that your doctor accepts your specific plan. And if you go the Medicare Advantage route, if you choose an HMO, then you'll most likely need a PCP, which is a primary care physician. Now, most specialists will also be covered under original Medicare. So things like cardiologists, pulmonologists, endocrinologists, surgeons, etc. will likely be covered under original Medicare. The same as with your general practitioners, this would be covered under Medicare Part B. Usually you'll pay 20% of the Medicare approved amount for a given service or visit, unless of course you enroll in a Medicare supplement plan, which covers your Medicare Part B coinsurance and copays. Now, like with the general practitioner, you don't really need to worry about networks unless, of course, you go the Medicare Advantage route, in which case you would need to ensure that the specialist that you intend on visiting is in-network, especially if we're talking about an HMO. Now, I do want to take one moment to talk about certain conditions, chronic conditions, and chronic condition special needs plans. So if you see a specialist regularly for some type of chronic condition, then you may want to look into a CSNP, which is a chronic condition special needs plan. And this is a type of Medicare Advantage plan. Now, we do have another video which goes into further detail, but basically the list of chronic conditions that make you eligible for a CSNP is quite extensive, and these plans are tailored to meet the needs of that specific condition. So again, if you are somebody that's suffering with a chronic condition of some type, definitely make sure to check out our video about CSNPs because these might be a type of plan that you might want to look into. You might also be surprised to find that psychiatry and psychology are covered by original Medicare. Services covered include yearly depression screenings, individual and group therapy, family counseling, psychiatric evaluations, medication management, and diagnostic tests. And other types of skilled therapy are also covered by original Medicare. I'm speaking specifically about habilitative and rehabilitative therapy such as physical therapy, speech and language therapy, and occupational therapy. You can even receive these in a skilled nursing facility care after a hospitalization if need be. Now let's talk about some of the doctors who do not accept original Medicare. And first on the list is optometrists. Now, let me get a little bit more specific here. Optometry is not covered by original Medicare unless it's part of a specific medical condition. So a yearly vision screening for contact lenses or glasses would not be covered by original Medicare. However, if you have diabetes, then Medicare would cover a once yearly screening for diabetic retinopathy. Also, Medicare will cover yearly screenings for glaucoma. That's once a year, once every 12 months, but only if you are considered high risk. So one of the following conditions must apply.
You have diabetes, you have a family history of glaucoma, you're African American and over 50, or you're Hispanic and over 65.
Also, audiologists do not accept original Medicare, and that's because hearing aids are not covered by original Medicare. And this is definitely a major surprise to many, especially considering how very common hearing loss is in senior citizens over the age of 65. Now, luckily, hearing aids are actually now available over the counter. This is a major change in the availability and the cost of hearing aids, so make sure to check out our video about over-the-counter hearing aids and how that may apply to you. That being said, ENTs, which are ear, nose, and throat doctors, are considered specialists who might accept original Medicare. But they're not going to be able to help you with hearing loss and hearing aids. And sadly, dentists do not accept original Medicare, so dental care is not covered, even though it is an incredibly important part of your overall health. Now, luckily, private dental plans are much less expensive than most people think, and they are readily available. Now, if you do decide to go the Medicare Advantage route, remember that many plans actually do offer dental, vision, hearing, and prescription drug coverage. But those benefits definitely come at a cost. As I mentioned earlier, if you are going to go the Medicare Advantage route, you're going to be giving up access to that original Medicare network of doctors and hospitals who almost all accept original Medicare for a much tinier, more restrictive network. So it can be difficult to find a doctor or a specialist or a hospital who accepts your plan in your geographical area. Medicare Advantage plans can be wonderful for some, but there are definitely some pitfalls that you want to be aware of. So definitely do your research if you're going to go the Medicare Advantage route, because they lure people in with all the additional benefits and the lower copays. And again, they can be great, but they can be not so great. So please make sure to do your research. And you're taking the first step by watching this video. But if you want to make sure that you stay up to date, make sure to subscribe. And of course, please give this video a like, click that thumbs up button to help us get this information out there to others who are looking for answers to these types of questions. Now, if you still have questions, you can reach us at the number on the screen, or of course, send us a message in the comments below, and we will be more than happy to help. We are licensed nationwide, so wherever you are in the United States, please feel free to reach out, and we will do our best to answer your questions. As always, thank you so much for watching, and have a wonderful day. Bye-bye.